Thank you. Good afternoon. So in preparations for the COVID-19 pandemic, what St. Luke's would like to share is that we are actively planning. We've been working within our Incident Command Center for over the last 2 weeks. We have a detailed plan that covers really all eventualities. It's a 3-tiered plan. We are constantly looking at a variety of projections in regards to what the pandemic may mean for our region and planning accordingly. We're working weekly with our great partners down the street at Essentia, sharing information, and that's been really, really helpful. We've also reached out to our regional partners in many of our critical access hospitals. We know how important their role will be as we all try to provide the best care that we can for this region. I guess the other thing I'd like to do is just briefly remind everybody that for the vast majority of patients who will have this infection, they're going to have mild symptoms. They may not even recognize it. So I hope that's reassuring. Testing remains limited. We continue to follow guidance from the Minnesota Department of Health in regards to who we can test. We understand that that is a very fluid situation. We would like to be able to test more, and we know that that is on the horizon, but I can't tell you exactly when that will be. So at this point, we continue to focus on people who are ill enough to be hospitalized, healthcare workers or frontline first responders who are ill, and also symptomatic individuals who live in a congregate setting. If you suspect you have COVID-19, but you're otherwise well, meaning you're not short of breath, you're able to eat and drink, you're able to care for yourself, you should stay home. Isolate yourself from others, and do that until 7 days after the onset of illness or 72 hours after your fever resolves, whichever is longer. If you have difficulty breathing, then you need to access care. One way you can do that in the St. Luke's system is to call the COVID-19 nurse triage line. They can provide you direction. They can hook you up to an e-visit, and those are free regarding COVID-19. If you have a medical emergency, please call 911. And the number for the nurse triage line at St. Luke's is 218-249-4200. So the COVID-19 pandemic has changed the way we provide care. With the governor's announcement that we are to halt elective procedures and routine appointments, we're now offering alternatives like telehealth and e-care. We had been doing some of this before, but we have had to rapidly ramp up our capability in those areas. And again, this is all in an attempt to promote isolation, as well as to preserve that very important personal protective equipment. We've also established the nurse hotline. These are all really, I would say, new endeavors that have been driven by our attempt to deal with this pandemic. So I would urge those of you who are used to visiting your primary care doctor, who have a required need for a visit, please contact your doctor's office and see if a telehealth visit is appropriate for your condition. They can help you sort through that, and our technology is allowing for that. I already mentioned the e-care visits. Those are useful, and the nursing hotline. At St. Luke's, we know there has been some news recently about our staffing changes. This pandemic is difficult to manage early on. It has really changed the volumes of patients that we're used to seeing, and there's great uncertainty about when we will expect to see the surge that may be coming. And so we're challenged, and we're working hard to make sure that our patients and our employees are really cared for as best we can. We want you to know that we value every single employee. They're the heart and soul of what we do. We know that once the surge arrives, it'll be all hands on deck. Until then, we're in kind of this no man's land where we have to be very good stewards of the resources that we have. You may have read that we have had to temporarily reduce some employee hours, and that at St. Luke's there's even been a couple layoffs, a total of 7. Those were situations where we literally had no work, and we regret having to do that. We also make the commitment to bring those employees back as soon as the work arrives. We are working diligently with many of our employees who are in parts of the organization that don't have a lot of work right now. We are building labor pools and repurposing their skills through training to get them ready to help with the surge when it arrives. Please know that these decisions are very difficult, and we truly regret the hardship that many are experiencing in our region. This is a tough time for all of us. I have alluded to that in the past. We feel isolated, and we're faced with uncertainty around something not seen in the United States for really over 100 years. So I wanted to mention just a few resources that exist. So there are a few websites that you can go to that will help in regards to your anxiety around the COVID-19 pandemic. Virusanxiety.com is one. There's also one called sandvello.com, SANVELLO. Take a look at those. Those might help with some of the anxiety that you're experiencing at home. There are apps like Breathe 2, the number 2, Relax. And then I think I would just reinforce what we had talked about before. Those personal hygiene things are so important. Washing your hands frequently. Dr. Pryor does a much better job of explaining how to do that. Covering your cough, don't touch your face, stay 6 feet away from those that you're around. But still, get outside, take a walk, get adequate sleep and rest and nutrition. That will all help as we approach this pandemic. Just a couple other things that we wanted to mention. You will see a change in some of the driving around the St. Luke's main campus. We, with the city's agreement, have changed First Street to a two-way street between 8th and 12th Avenue East, and this is going to allow for us to start to build the capacity for our tiered response to this pandemic. The signage is pretty good. Please be careful if you're coming to the campus that you pay attention. It is different than what you may have experienced before. We will be repurposing some spaces in other buildings, and we'll try and update you when we get there. But don't be alarmed by that, and again, that's all just preparatory work. There will come a time when, as part of this phased response, we will be closing down First Street between 9th and 10th Avenue East, and we'll be controlling that as a evaluation and treatment space. So that's just a note for the future. We appreciate the time, the opportunity to talk with you. We are preparing in earnest. We are thankful for your support. Once again, I can't say enough positive things about this community. We appreciate the thoughts, the support of food and PPE. And again, I just want to say thank you for doing the right thing, for staying home, for staying away from others. With your help, we'll get through this pandemic.
Good morning, and thanks for joining us again to talk about COVID-19. My name is Dr. John Pryor, and I'm the president of Essentia Health's East Market. And again, I can't say enough about how pleased I'm being here with our neighbors and our collaborators, St. Luke's Hospital and Dr. Van Deelen. And the real heroes in this room are Dr. Thompson from St. Luke's and Dr. Prabhu from Essentia. These are the infectious disease doctors who we go to all hours of the day. I don't know when they sleep. They're available and working 7 days a week. That is no exaggeration. I know that we met just last week, but that feels like a lifetime ago. So much has changed. This includes 3 positive tests in St. Louis County. It's likely that COVID-19 is spreading broadly across the state. As testing capacity increases, and we hope it does, we expect to see many more confirmed cases. I say I hope it does because we want to confirm cases earlier and hopefully isolate these individuals and prevent this from spreading further. This spread is true here in our own communities. It is affecting us in St. Louis County, which is why it remains crucial for us to take seriously our role in slowing the spread of this virus. The best way we can do that is to abide by Governor Walz's executive order to stay at home. You all have a role in helping us to spread this message. I personally don't think everyone really understands it. On my way over here today, there was a couple that was trying to get into a nearby restaurant, and they were surprised and disappointed that it was locked. And I think went back to the car, hopefully home, and not in search of another place to eat. This is not staying home. By staying home, you are buying hospitals time to boost their capacity and prepare for a surge of COVID-19. And if you've read in the media, the expected surge is to be up to 2.4 million people in the state of Minnesota. Proper care, including access to ICU beds, dramatically improves a patient's chance of recovery. That patient could be you or a friend or a loved one. I promise you, everyone in this room, everyone watching this is going to know somebody impacted by COVID-19. As testing supplies remain limited, we continue to emphasize our e-visits and virtual visits. We are approaching 500 e-visits daily. That's 500 every day, and those are free for patients concerned about COVID-19. Similarly, we've conducted about 3,000 virtual visits in the first week since that launched on March 18th, and this is just continuing to ramp up. Go to essentiahealth.org for more information about e-visits and virtual visits. I'm going to be candid here. We do expect a surge of COVID-19 cases. Predictive modeling, which we're conducting both internally and in collaboration with the state, will help healthcare systems like Essentia and St. Luke's prepare for that surge. There are unknowns, however. When will the surge happen? How many people will be impacted? How long will it last? These are questions that we can't answer definitively. But we can proceed with caution, practice social distancing, and look out for one another. I'm a runner, and so I'm going to use a running analogy. This is a marathon, not a sprint. Navigating this pandemic is going to require discipline and patience from us all. But we can and we will get through it. Thank you very much. And I think we're going to open it up for questions and answers, and we invite Dr. Thompson and Dr. Prabhu, who again, they're the real experts in this, and so they'll be taking a large majority of these questions.
Dr. Pryor, St. Luke's has been pretty transparent with us with regards to layoffs and reducing hours. I get the sense that we're not really getting straight answers from Essentia. We're hearing, for example, from respiratory therapists who say their hours are being cut, they're not being given a choice. Those people particularly. Can you clarify for us, please, what's happening at Essentia as regard to layoffs and or reducing hours of your workers?
Yeah, I can't speak so much to the reducing hours. I'm not aware of exactly where hours are being reduced. In general, we're trying not to reduce hours because we think people still need access. Again, we're trying to provide that access primarily through e-visits and through virtual visits. We recognize that there are some people without elective issues that need to be seen, so we're doing inpatient visits when necessary, and we're doing surgery and procedures when necessary to take care of those things that we can't postpone until after the surge. We are being very careful in terms of analyzing our employees and figuring out who and when people can be put on administrative leaves and whether or not there should be any layoffs. Again, just like St. Luke's, we're no different than them and no different than any health system in the United States. We are trying to preserve our resources, recognizing this is a marathon. If you don't have the money to pay people to be here to take care of, when we really have a surge, that's going to be a major problem. So we are trying to be responsible about that. We're trying to be very thoughtful about that. And after we have notified our own employees and what we're thinking, then we'll be in a better position to give more specifics to the press.
So to be clear, no layoffs today?
None that I'm aware of, but we're just looking into our resources. We're still in the thinking stages right now.
And how is hiring being affected? I looked at Essentia's page on Friday, and there were hundreds more openings than there were on Monday. And St. Luke's as well, are there being decisions made about staffing and only hiring crucial perhaps?
So I can speak better to the physician hiring than to the APPs, or the nurse practitioners and PAs hiring, but I think it's pretty similar to the just general staff hiring. We have been very careful. Obviously, we don't want to bring in people, even to do interviews right now, because we want people to stay at home. And all of our attention really needs to be on preparing for the surge, not what kind of interview questions we need to think of and bringing people on and onboarding. We are continuing to recruit, but we've really either postponed, slowed down, in some cases rescinded some offers, very few, but in some cases, primarily we're really postponing and delaying as much as we can till after the surge. So that's been our focus.
Yeah, I would only add that we're both complex healthcare systems. We have ongoing needs for critical employees across the board. And when we have employees who we've recruited who bring really important skill sets and experience who could be used, we think those are important hires that we are going to follow through on. Other than that, I would totally agree with Dr. Pryor. We are converting a lot of our interviews to tele-interviews, and we are postponing much of the recruitment that had taken place prior to this.
Let me build on that a little bit, because I'm going to tell you where a lot of my efforts are going to be going in the next few weeks. So we are trying to prepare for the surge. This is what we're focused on today. And there may be some people there's probably a lot of people right now, quite frankly, who are not that busy. However, and let me just give an example, is the hospitalists. These are physicians and APPs who are taking care of people on the wards in the hospital. Our census, how many people we have in the beds, is very low right now. So you think, let's just, they're not busy, we can, furlough them or whatever. The fact of the matter is, this is our opportunity to prepare for the surge. And so we're thinking of, how do we redeploy people when our hospitalists get sick to take those positions? So for example, we may be talking to some family practitioners who are working in a clinic but may have had some experience working in the hospital before. And then we've got a couple of weeks to train them to take the hospitalist position. And the hospitalists in turn may need to work in the intensive care unit if our intensivists get sick. And so really this cross-training, this redeployment, we've got this opportunity when we don't have the surge to train people up and to prepare for what's going to happen in the near future. So really anyone, in my mind, anyone who's not busy right now, we're looking at how can they help us in the future.
For both of you, how are the reduced hours and the layoffs on the St. Luke side impacting the hospitals and clinics on the Iron Range?
I personally think that the same thinking, I know that the same thinking at Essentia in the Twin Ports is happening in the Iron Range, is that we're trying to put most of our focus on the surge preparing for that, redeployment, cross-training. We're also trying to give people an opportunity to, if they're not busy, to either voluntarily, step back and rest, because we know that at some point we're going to really need a lot of troops. And it is a stressful time right now in the health systems. We're busy preparing, and we're nervous about what's going to happen going forward. And so if people can get a little escape and build up some resiliency and rest, because when this happens, we're going to need all hands on deck. And I think that that's happening not only in the Twin Ports area, but on the range as well.
I would echo what Dr. Pryor said. Those are busy clinics. We're in touch with them constantly. In the St. Luke system, those clinics have been actively developing their own plans. There are no layoffs scheduled or planned there. We're trying to move as many appointments in those clinics to telehealth appointments so we can continue to provide the great care that our patients are used to. So yes, on the main campus, our efforts are not entirely, but very, very focused on preparations for the pandemic, but we know we have care to continue to provide.
Dr. Van Beelens, as regards to St. Luke's, what we're hearing from at least one or two frontline workers is mixed message, confused message from messages rather from management. Would I get PTO if I'm sick? Don't I get PTO? We're hearing two different things. Frontline nurse saying we're not being shown how to use N95 masks. We were supposed to hear from an infectious disease person, and it turned out to be an administrator who couldn't ask our questions. And the word this person used was chaotic. Can you speak to that?
So what I would say is that we have daily communications. Much of our communication has to do with specifically questions in regards to human resource issues and PPE utilization. We do have to be very careful in regards to our PPE utilization, primarily because we know that as we approach a surge, we have to have large amounts available. I would say we have been extremely clear about that. I think there is great fear, and that is generated, I think, from a real place of just kind of honest vulnerability. So we understand that. I think in regards to who and when you should use an N95 mask versus a droplet mask, my colleague Dr. Thompson and I have spent countless hours being very clear about that, following the recommendations by MDH and CDC. Fit testing, we've had to prioritize high-risk areas. We have worked through the backlog of our high-risk providers, and we're moving down the line. So I think sometimes it's hard to get that message out, but when you're preparing for something like this, we do have to make sure that we are prioritizing the most impacted areas first. I think in regards to utilization of PTO versus other types of paid time off, that's a challenging calculation. I am no HR specialist, but I know that our leadership in the Human Resources Department has done really quite a good job of trying to clarify what's a constantly changing and confusing situation. Again, I would echo what Dr. Pryor is saying. We think it's a great time for our employees to step back if they can. If they don't have work in their area, there's probably a period of time, maybe a couple weeks, where it would be good to step away. That may be voluntary. They may have PTO they can use. We do have clear direction available on our intranet site, and they can always contact our HR department.
I'd like to respond to that as well. I realize the question about chaos was not addressed to Essentia, and let me say that if we are not chaotic today, there will be times it will be chaotic tomorrow. We've got 14,000 people at Essentia. It may be chaotic for particular groups. I hope that everyone, both the press and the people watching you later on today, recognize that this is something none of us have ever experienced in our lives. The only time I've ever experienced pandemic is when I played the board game. This is really serious. This is going to affect between 40 to 80% of the population. And I'm not telling you anything new. You've read the numbers on the mortality rate. It's a very low percentage. Most people are going to be just fine. But when you apply that against how many people it's affecting, it's a lot of people. So if it appears chaotic at times, it's probably because it is. This is something that we've never had we've had dress rehearsals before, but this is real life. And it's changing minute by minute, not even hour by hour. Supplies are we don't have the supplies we need, and then some supplies show up, and then we don't have supplies. The testing, we were just talking, Dr. Prabhu and I were talking just right before this press conference, that the testing ability is changing. We've heard rumors that it's about to change, and MDH will probably come out with some new recommendations in the future about that. The predictive models change on a daily basis. So I think that a certain amount of patience and compassion needs to be given to the thousands of people who are working way over 40 hours a week and trying to get us prepared for what we're about to be hit with. So if it is chaotic at St. Luke's, let me tell you, at some point it's going to be chaotic at Essentia, and I ask for a little bit of forgiveness there.
Last week you told us between the two of you you'd run about 200 tests in the Duluth County Twin Ports area. Can you give us an update on how many tests you've run since then? And we'd heard from the governor that there is more testing capability, that they have received more supplies. Have you received those supplies, and if so, why aren't you using them, I guess?
Dr. Thompson, this is where I gladly turn it over to Dr. Prabhu.
I don't have absolute numbers to give you about how many tests have been run at our hospital because it's changing constantly. The Minnesota Department of Health does have numbers that they've run throughout the state, and we now know, since we started talking, I think this morning, that there are 346 positive tests out of thousands, and 5 of those are in St. Louis County. We are trying to very carefully steward the tests that we have. We would love to open that up to more patients who might be at risk. We would love to open that up to the broader public, but we want to make sure we have the tests that we need to care for the sickest people in the hospital and our employees and other folks at risk. So as soon as we feel prepared to open that up, we will.
Have you not seen those additional supplies? The governor mentioned yesterday they had received some in the state anyway, and they were passing them out to hospitals. Have you not received those?
Not to my knowledge.
So, I could address that. So at Essentia, so far, we're talking the whole Essentia system, tested 645 people. And it's not that we do have tests on hand, meaning what's involved? Sending it to a reference laboratory. So at the moment, we're using our reference laboratory to do COVID-19 testing. And since we spoke last week, our turnaround time has improved. So I'm seeing personally turnaround times of 1 day. We have a courier going down every day. The other sort of rate-limiting step you've heard is testing supplies, so swabs. We do have swabs. But as Dr. Pryor said, this is a marathon, not a sprint. So we have to be judicious in our use of supplies. If we burn them all early in the process, and then we have people presenting to the hospital with high probability of COVID-19, we won't have those. But, it's just not a St. Luke's Essentia things. We are getting help from federal authorities. You may have heard the term the emergency preparedness stockpile. So we've gotten word. I know North Dakota, we have Essentia sites. They're getting supplies released to our Essentia facilities there. And I think Wisconsin, and we haven't heard anything specific from Minnesota. Are questions on that?
Well, I know you both mentioned that you're going to do a pop-up drive-through testing. Can you give us an update on how that's going?
So when we talked last week, we had prepared to open our curbside testing facility to basically help out our clinics and relieve the pressure on our clinics to do that testing. Around the same time as when there were significant limits in testing capability. Not what we could do, but what the Minnesota Department of Health could perform. And I have not heard from them that they have an increased capability. There are some reference labs, such as at Mayo, which we've been using, and we anticipate that they will have more capability. But again, there are other factors to consider. Our local availability of swabs remains a concern. So that may play a role in the future, but again, we want to be prepared to really do it well if we do open off-site testing.
So at Essentia, we do have particular hubs for testing. So in this region, in the West Duluth area, and Virginia. So those are up and running. I think what hasn't changed is the testing criteria at the moment. So as I talked about, healthcare workers, first responders, people that live in congregate settings, long-term care facilities. And for those that live in those particular settings, it doesn't mean they have to drive to those testing centers. Those samples still can be acquired locally and submitted to us, and we will do that testing for them.
We've seen a national tug of war between reopening the economy and keeping people at home, keeping people away from each other. How long do you anticipate that we're going to need to be socially isolating to best control the pandemic in Minnesota and elsewhere?
So, I mean, the social distancing part will continue until we're well past peak. We're not even at peak. So the purpose of that is to prevent or reduce the number of people that will actually get COVID-19. So the goal, I mean, you've heard this flattening of the curve thing, basically saying, trying to get as few people as possible infected. And you have to remember that at least 80% of the people have mild or minimal symptoms and will not require hospitalization. And I think that's one of the reasons the health department, we're following their guidance as well as all the healthcare systems in Minnesota, is that we want to reserve testing for people that we will feel that'll make an outcome difference for them. Meaning, if they're truly sick and need care, we need to know what they have. But if they have a minor illness, we're just reserving testing. And that can change day to day. I mean, we're getting updates day to day, hour by hour, in terms of capabilities of testing.
Doctors Pryor and Van Deelen, you both mentioned the coming surge, or the likelihood of a coming surge. And we talked about this a little last week, but is there any progress toward our talks about what will happen if there simply aren't enough beds left in the two hospitals?
So we are thinking about that. We are at Essentia, we're a system of hospitals. We're looking to our other hospitals that typically don't take as sick of patients, but how can we use them when the surge happens and when we've run out of beds here in the Twin Ports? We're probably going to have to be doing some thinking beyond that, such as, do we get an external facility ready for us? When you look at, just to kind of paint the narrative here, what I read is that in New York, they need, I think it was 30,000 vents, and they've got 11,000, I think, is what the number is. That's a real problem. And again, everyone can read the papers, what's happening in some other countries like Italy. So our goal is to, again, I can't say this enough, the first thing that we need to do is follow Governor Walz's executive order and stay home. That's going to be the number one thing that we can do to help us prepare for this so that we do get enough resources. And then that will buy us time to hopefully get the resources that you're alluding to cross-train people, and to be better prepared for when it hits us up here in northern Minnesota.
Yeah, so I would, again, just echo that. So St. Luke's has done very detailed planning in regards to what our capacity is. Treatment spaces, all the critical equipment that it requires to do high-level critical care for our patients, and general care. So we know what our capacity is, and we know what we can get to by repurposing staff, spaces throughout the facility. We've worked closely with Lakeview Hospital, our other hospital in our system. We know what their capacity is. We've already started the discussion about what might be best in regards to patient mix. And we've engaged with the Wilderness Medicine Coalition of critical access hospitals in that discussion. There's also a regional healthcare coalition that also contributes to determining how do we best care for the surge that's coming. So again, I think we're all doing that work, and I can tell you that work is being done well. But the reality is what Dr. Pryor said. The most important thing right now is what you do. It's not what we do. We need to be prepared, but it's really the self-isolation, the social distancing, the critical adherence to what the governor and really the city of Duluth both have directed to slow this down, because it's that extreme spike that will overwhelm local health care. And so we think we're in a good place for that. I think we're very hopeful. We're planning for whatever might come, but it really is the responsibility of all of you.
You're not looking at, for instance, quick follow-up of putting beds in the deck, as an example.
Are we looking at that? Yes. I think that we need to plan for every contingency. And we know that at a certain point we may need a third facility. And so from our perspective, would that be on the table? Absolutely.
Anybody else want more?
I have one from WDIO. They were wondering, why is it important for patients to go to their dentist rather than the ER for dental emergencies? And I guess you could just broaden that out to any kind of specialized care like that. Why should people go to those particular doctors and not the ER?
So I think it's the important thing about that is the order to shut down elective procedures and routine visits affects the dentists and the oral surgeons as well. And yet there are dental emergencies all the time. And so our dental colleagues want you to know that they're available to care for those patients. Why is it important? Well, because they are the experts, and because we need to keep those patients out of the emergency department so they're not exposed. We're trying to keep folks from not getting ill when we can.
Actually, I just want to say that many years ago, I used to work in the emergency department too at Hennepin County Medical Center as a resident. And while emergency department physicians can take care of dental emergencies, you don't want them to. It's better to go to the dentist.